Welcome to another episode of MedTalk. We bring various experts to discuss current and important topics to benefit our audience. This is our seventh episode during current public health crisis and pandemic with COVID-19. As we are trying to ease the restrictions and open up the economy, many questions are still unanswered. There are a lot of confusion and uncertainty. There will be new normal post COVID-19 pandemic and a lot of questions regarding testing, both antigen testing and antibody testing. Many medical professionals are also need clarity on what to order and how to interpret and what steps do they take to advise their patients. We are as medical professionals are not happy with how this was handled as we were not prepared to provide a response for such a magnitude pandemic worldwide. Today, we have two special guests, Dr. Pradip Shah and Dr. Pooja Shah. Both are infectious disease physicians practicing in Edison, New Jersey. Both are actively involved with New Jersey State API and well-respected professionals who provides frontline services to COVID-19 patients. Welcome, Dr. Pradip Shah and Dr. Pooja Shah to MedTalk.
Thank you.
Thank you for having us.
So let me start by asking a question to Dr. Pradip Shah. As a senior physician practicing in the area, your practice must be changed in last few months with COVID-19 response. So what can you tell our audience about how the things are in your world? What will be the future or new normal in the US and across the globe post COVID-19 recovery and reopening phase?
Okay, so as you all know, the COVID has changed all the rules, or it's a whole world upside down. Every rules has been broken. It's not purposely, but because of the condition of the COVID has done to us. We had seen such a tremendous amount of patients, particularly young, old, everybody who has affected this, and whole world is affected. So going forward, I usually compare post-COVID with the post 9/11. You know, 9/11 has changed our whole life. When you travel, everybody has to go to security, everybody has to do this.
Yes.
A similar situation now, post-COVID area will be the same. Be prepared to get changed. You know, I personally don't think that it will be normal what we had pre-COVID. It's going to be changed. How and what is remain to be seen, because we still don't know this virus. Everybody is guessing, everybody is doing. No doubt that medical profession has done excellent job in this. All medical profession, I'm talking MD, nurses, whole people. And they have done tremendous job, and I thanks to every of us, you know, that we have done very good job. But the post-COVID area will be different. The worry is about what I have labeled as a COVID surge, 1 or 2, whatever number you want to give, that's not a, but COVID surge can happen. And we don't know even what is going to happen in
The fall. Yeah.
fall or in the March, what we had.
Yes.
So,
I'd like to also add, even when we start to go into the post-COVID era or like the period right now, we have to be worried more about all precautions still should be taken. We don't know what's going to happen, but if the public is saying that, you know, the government, whoever is saying you need to wear a mask, I would recommend you wear a mask. Things like that, little precautions, if you still take, it would be very crucial to help prevent a future surge.
Yes, absolutely. I agree with both of you. So let me ask you a very important question on testing aspect, which may be in mind of many of our viewers, and I'm sure a lot of medical professionals as well. Testing, tracing for any communicable disease is a very, very complex matter. As I am in public health for last 30 years, and I know how difficult it is even for chicken pox or other communicable disease we have to trace. Not everyone can easily understand. So Dr. Shah, both Dr. Shahs, can you start with what exactly antigen testing and what is antibody testing, and what are the importance of this testing now to ensure we reduce the spread and overall mortality?
okay, so let me just start out within that. We are still learning about the virus. So whatever I say, it may change. It's not a permanent. But
Correct.
what I'm going to get it is what we know as of today. That's what I'm telling. It can change a lot. So that should bear in mind that whatever I say. As of today, there are two types of testing, antigen and antibody. And let me go to what is antigen test. Let me talk. Antigen test is the virus itself they test it. Now, it's positive when first of all, any test you do, it depends on what stages of the disease you are going to the doctor.
Right.
Okay, so that will start. So begin with, let's start the patient who has a symptom begin day one. So at that time, I think antigen test is the most perfect.
Yes.
But in that also, there is a caveat in that if you don't do proper way, it can be falsely negative. So it has to be done proper way. Number two, the antigen test can be positive, some people up to 6 to 8 weeks, we don't know. So it doesn't mean that you have active, because remember, it measures is the virus RNA. So virus RNA can be in the dead and live virus. So it does not differentiate between dead and the live virus. All it says that it is positive, that means virus were there. So if you do after 2 weeks, if it is positive, usually it's presumed that the virus were dead and it's positive. So it doesn't mean that you have active infection.
Mhm.
No.
And then when you come talk about the antibody testing, there's two parts of the antibody testing, a component called IgM and IgG. Most of the time, based on what we know, you're supposed to build, this is to help build your immunity against the virus. That's what the antibody stands for here. So most of the time, people by end of the week 2, starting in the week 3 or week 4, should be building both the IgM and IgG with this virus. But it can take up to 6 weeks to build the antibody testing. So sometimes if you get an antibody testing, it's negative, but you're not aware of what your antigen test was. Sometimes it might not show up on the blood test right away. But it all depends on timing in order to see where these both tests falls.
So, yeah, go
Wait, one thing I want to point in for medical profession particularly. See, usually whatever any infection, your IgM first comes positive between 2 to 4 weeks, and then IgG start. But this disease is little different. What we have noticed so far, some people develop IgM, some develop IgG, and some develop both. So the problem is that we cannot say which one will come. So right now, the best state for antibody is total antibody, which will give both IgG and IgM, which is very important because some people only order IgM, then it's not good.
Not good. Yes, yes, yes. So, Dr. Shah, let me ask you a very important question. If I'm a healthy individual, I did not get any exposure of COVID-19. Why do I want to get antigen testing right now? Is there any benefit of getting me tested myself or whoever is not been exposed? What are the benefits of getting the antigen testing if I don't have any symptoms, if I'm not been exposed?
Okay, so the antigen test, people who are not exposed or asymptomatic, let's put it that,
Yes.
there is no benefit, because the only time if it's only high risk people who are working in the public sector, you want to do that test because if you have antigen positive, and you are, because this comes back to the pre-symptomatic phase, which is very dangerous.
Yes.
Pre-symptomatic phase is when usually 1 to 5 days before you start the symptom.
Correct.
At that phase, if you pick up somebody in 1 to 5, it's very important, because if that people is in the public sector, he can infect many people because he doesn't know even yet. So that's one reason to do antigen in those people.
Yes.
The other people is, if you are going to be isolated, there is no sense in doing until you develop the symptom. At that time, you do the testing. So the most important part in the public sector, people who are exposed to many people, which is not by choice, but by compulsory, infrastructure. So
Yes.
that's where the test comes positive.
So who is eligible to get COVID-19 testing? Can you describe high priority and priority for testing right now? Or anyone can get the antigen testing if they want to?
As of now, I think it's been open to the public to get tested. I know some cities are offering free antigen and antibody testing offered to people to get tested. So as of now, it is open to everybody. But at this point, I would recommend people who are higher risk, especially if they're going back to work, just to make sure they know if they've been exposed or anything like that. That's good to know. But I think that it's slowly being open to all the public.
So is that true for the antibody testing as well, that anyone can go and get the antibody testing before they go to work or they start their own business? Or what are the criteria for the antibody testing? Is it open to everyone? Is it covered by the insurance company? Do you know?
Okay, so antibody is very interesting case. The reason you want to do antibody, there are two different ways. Those people who think they are exposed, they want to see they were exposed and there is antibody. It doesn't mean, by the way, I want to just tell you one thing. Antibody present does not mean that you are immune. I
Yeah.
want to make it very clear that we don't know yet. Number two, if people who have antibody positive, they can donate the plasma for a sick patient. So there is another purpose of doing that test,
Antibody testing.
antibody test.
Yes.
Number three, if people, this pandemic has caused a lot of panicky, lot of people has, when really hits you, it's realized that, you are something and that is happening. So people are curious whether, even though they didn't have symptoms, they want to make sure that they are immune, not immune, but positive or immune. So they do the testing. Now, having said that, I believe the insurance has told them that they will cover the testing. Now, hopefully, they will continue to do that. I think there is another issue in this, what is called herd immunity.
Herd immunity.
Yeah.
That you want to know how many people were exposed, whether symptom or not is not it. So that helps, like you are epidemiologist, you want to know herd immunity of the population in that area.
Yeah.
So if anything hits you, they can check. So that is another purpose of doing antibody test.
Very good. Pooja, you want to add something?
No, that's good.
Yeah. So, as an infectious disease physician, you both are involved with New Jersey State RP, the biggest physician organization in the state. What are your thoughts on where are we heading with this pandemic in the state, and how long it will be before we see new normal in our life? I know it's a very tough question, but I think a lot of people now, instead of the initial anxiety of the COVID-19, they have the anxiety of when will they get to normal. And I think that's a legitimate concern for many of us, including myself as a physician. But what are your thoughts on where are we heading? Are we heading in the right direction, especially in New Jersey? Or what are your thoughts on a global level?
Well, as of now, I think the state's doing a good job trying to open up things slowly. As we all know, like beaches are opening up for Memorial Day weekend. Some restaurants will slowly open up. I think you have to open things very slowly because as of now, the cases of COVID has come down in New Jersey, and it's at a lower number than it was maybe a couple weeks ago or even a month ago. So you have to see when you start to open things up, what will happen to our number of COVID cases. Is there going to be a rise or is it still going to come down? And as things slowly open up, then we'll start to see when things will get better. A time frame, it's hard to say. We don't know because every week it's going to be a new view of how many cases we have, how things open up, and how the state will respond to that.
Correct.
The one thing, yes, I think we have to be very vigilant, and I believe that if I consider that any patient who comes to the emergency room need to be tested because we don't know, what is. There are many reasons to do, but one of the reasons is to know that we are getting more patients or not is also very important because you have to be continuous vigilance to see whether we are getting more. Because if patients are home, they are not going to testing them.
Yes.
But if a patient who comes to the ER need to be tested for them,
Correct. So how can we help our viewers? Let's say if they develop some symptoms, if they have fever or body aches or cough, can they go get the testing at some testing center? Or what is your advice for those individuals who has insurance and want to get the test done? Should they call the physician first, or what is your advice?
I think they should definitely call their physician first. Let the physician screen to think if they have a high risk for COVID or could it be another infection. Sometimes we don't know. And then the physician can guide to where they can get testing done.
Okay.
Also, yes, it's very important. But like sometimes the physician, let's say they get Friday night symptom, and they cannot wait, then they can make appointment, go and testing. I think testing is available many places, many places done. If you are in doubt, just test it out. It doesn't matter really. I think vigilance is very important, because if you don't test this person, you can imagine that how many people will get infected. It's not, I'm just talking about small number, but that
Yes.
multiplies in that.
Absolutely. So if someone gets sick on a Friday night, or during the weekend, the long weekend is coming, do you advise them to, if their physician is not available, they can call the emergency room, or testing center to get the test done?
I believe, yes, you have to do it, because, 3 days is a long, you can
Yes.
infect so many people,
Exactly. Yes.
unless you isolate, but still you want to know that
Yes.
whether you have it or you don't.
Yes, yes. So what is your advice? Long weekend is coming up, starting Friday. People will be probably in the mood of long weekend. Memorial Day weekend is coming up. The beaches will be open. The businesses probably will resume differently. What is your advice, common sense advice for the people not to catch the infection? Because I think the number is going to increase, in my opinion. And I think overall mortality is going to be increasing as well in the US and other places. What is your advice, common sense approach for our viewers to take some precautions? Because we are not off the hook yet.
Mhm. I still recommend you still have to be doing social distancing. Keep your distance at least 6 feet from other people. Wear a mask, hand sanitizer, hand washing, all the same precautions we recommend everybody to do. It's very important that way. And as long as you exercise that, I think, that's the best way to help prevent picking up the disease, or if you have it spreading to other people.
Yes.
And that's what you should do in the public. Keep your distance as much as you can.
Yeah.
Mhm.
Yes. Lastly, any departing comments or take-home message for our viewers and medical community and providers on how you can help them?
Yes, the testing for medical doctors or whoever is ordering the test, please notice that what test you are ordering, what is the time period when the is, and how to interpret that test, and that there is a lot of question about medical, when person can go back to work, and it's very, very complicated. It's not just simple ABC that you can work, because the ideal way is that a patient who has a positive test, usually 14 days plus 3 more days asymptomatic without taking
The
any
fever. Yeah.
Tylenol or any symptom. Ideally, they can go back to work. But every employer has their own rules they have to follow, which I don't blame them. I just get that paper. But ideally, if you have a symptomatic disease, 14 days plus 3 days asymptomatic, then you can go back to work. Now, other thing is, some of the question I was asked, I want to reiterate that a person who was positive day one, 14-day antigen test was negative. Then they did 1 week later, again positive, and then antibody is negative. How do you interpret that? Well, only one thing I can tell you, this person had a COVID infection. The negative, because there are false negatives sometimes.
Correct.
The second test negative has no meaning. But the purpose of the third test, I don't know why even it was done. But that's a different story why it was done. But to interpret is really difficult. All I tell you is that if you have positive test, the antigen can be positive up to 6 to 8 weeks. So it has no meaning after doing that test. Number two, antibody will tell you, yes, you have an antibody developed, and is immune or not, we don't know yet.
Don't know yet. Yes, yes, yes. So thank you so much, Dr. Pradip Shah, Dr. Pooja Shah, for your time and expertise in providing some valuable information on testing aspect for COVID-19. Appreciate your time to come to MedTalk for interview. I know Dr. Pooja Shah, this is your third time from your busy schedule. I wish you all the best in serving your patients and our community and staying healthy as well. Thank you so much, and hopefully we can come back and whenever we are fully recovered from this, and give some ideas to our patients for the next wave, if there is a next wave coming up. Thank you
So
so much.
the last, be safe, please observe the social distancing, and do the right thing, because you don't want to repent what you have made a mistake.
Exactly.
Thank you so much for having us.
Thank you.
Thank you both.
Thank you.
Thank you.
Stay safe. Thank you.